I'm Dr. Andrea M. Slominski. I was recently interviewed by Shawna Robbins for Authority magazine on the problems within U.S. healthcare for women over 40. I'd like to share with you some of the key points we discussed. I think they're important. As a therapeutic life coach for women going through perimenopause, menopause, midlife, and postmenopause, I've spoken with hundreds of women about the difficulties they have getting appropriate health care at this stage of their lives. So here are the 5 ways I think the U.S. health system can improve medical care for women over 40. First and foremost, physicians need to start listening to women. One of the chief concerns and complaints that I hear from women over 40 is that their doctors don't listen to them. Women who are entering the perimenopause, menopause, and midlife shift, who go to their doctors looking for answers and support, have been told for too long, "You're too young to be in perimenopause," or "It's all in your head," or "It's not that bad, just tough it out, it'll all be over soon." Whether a woman is seeing her primary care physician, her OBGYN, endocrinologist, or another specialist, physicians need to listen to women. Women go through so many cyclical changes in their bodies during their lives that they're often very sensitive to changes that begin to happen in their physiology and their psychology during this time of life. Number 2, education is a key component to improving women's health care. Women need to be better educated on what to expect in their regency years, the ages from about 45 to 70, so we can make adjustments to our lifestyles and healthcare plans to ensure a long and healthy life. In the past few years, menopause is having a hot moment. It's begun to come out of the shadows. Women who are over 40 today are among the first generations of women in the history of humanity to live past menopause together as a cohort. In the year 1900, statistically, most U.S. women were dead by 51. As our life expectancy increased, this new life stage emerged, one in which we're living now from 50 to 80 and beyond. We're making this journey together through menopause into postmenopause, creating a new life stage. And in this life stage, if we want to live our most vital and authentic lives, we have to be informed and take care of our health. Until recently, the subject of menopause was considered taboo. Generations of women, from grandmothers to daughters to granddaughters, didn't discuss the changes of this time of life. With increased education and the normalization of this life stage, the shame and confusion that many women fear can be eliminated. Number 3, physicians also need in-depth education and training on the changes that peri to post brings. Believe it or not, little or no time is spent in medical school or residency training physicians about the changes of perimenopause, menopause, and postmenopause. And because each woman has a peri to post experience that's unique to her, it's imperative that physicians understand that each woman needs a treatment plan tailored specifically to her. It's impossible to develop a standard protocol for menopause and midlife treatment for women. Number 4, now that women are living longer, we have to accept that we're going to face unique health challenges, and additional health testing, I think, should become standardized protocol. Additional tests for women over 40 should include a detailed hormone blood panel, a complete thyroid blood panel, DEXA scans for bone density. If a woman's family has a history of gynecological cancers, she should have an internal ultrasound. All women, of course, should have breast cancer screenings, pap smears, and annual physical exams. The early addition of some of these tests could prevent the onset of serious health problems later in life, protecting women's bones, cardiovascular systems, minds, happiness, overall health, and strength. This would also allow physicians to support women's health decades earlier, resulting in better outcomes and potential long-term, real healthcare cost reductions. Number 5, our healthcare system needs an overhaul. We're the only nation in the global north that doesn't offer nationalized healthcare to all of its citizens. It's beyond time for lawmakers, physicians, and patients to design a healthcare system together that works for everyone, including women over 40. The difficulties that other national healthcare systems experience is often held up as an example of why nationalized healthcare can't work. I don't believe it. The United States has some of the brightest minds in the world. If we can put humanity on the moon, we can certainly work together and solve the problem of healthcare. It's just a matter of our priorities. In its report on nationalized healthcare versus privatized healthcare, the Harvard University International Socioeconomics Laboratory writes, quote, nationalized healthcare under a single Medicare system would save 68,000 lives a year. In fact, nationalized healthcare would impact the working class in two ways: small businesses and job opportunities. The average American family would see a positive annual savings of about $2,400. This becomes largely significant when looking to the 53 million low-wage workers in America who would therefore add trillions of dollars to the national economy annually, close quote. Well, it seems like a great idea to me. If you'd like to read the rest of the interview, you'll find the link in the comments below. Thanks for listening. Be well.